My ministry, through the Department of Civil Protection and in collaboration with the national, provincial and district civil protection committees, UN agencies, NGOs, development partners and private sector are making interventions to assist the flood-affected communities. However, gaps still exist which require more humanitarian assistance as follows: shelter and non-food items. There is an inadequate supply of tents for the displaced people. There is an urgent need for blankets and clothing for the affected families as they are at risk of contracting pneumonia and acute respiratory infections, among other diseases. Girls and women need sanitary wear, and school children need stationery and classroom tents. Health and nutrition. There is a need to support health and nutrition for families who lost their foodstuffs. The affected children need micronutrients to prevent malnutrition. There is a shortage of essential drugs due to increased demand, especially in Cholocho. Water and sanitation. There is an urgent need to ensure affected populations have safe water to prevent outbreak of waterborne diseases. Food and security and nutrition. The Ministry of Public Service, Labor and Social Welfare is responding timely to food problems by providing rice and maize grain or mealie meal. In disaster situations, mealie meal is preferred to maize grain. There is need to provide relish such as pulses for a balanced diet. Education. Scores of schools need abolition facilities as they were destroyed. Classroom tents, stationery, furniture and textbooks are also needed. Some teachers' cottages were destroyed, making them unfit for human habitation. Roads infrastructure. Most roads have been turned into gullies, and almost all districts have reported areas that are inaccessible following the collapse of bridges. The affected district civil protection committees also need all-terrain vehicles to navigate the damaged roads. Damage assessments with adequate funding. My ministry is geared to coordinate the process to conduct comprehensive damage assessments, which include the cost of rehabilitation. The management structure, the flood disaster is to be managed by the Cabinet Committee on Emergency Preparedness and Disaster Management Committee under my chairmanship, as well as the provincial and district civil protection committees being chaired by provincial and district administrators, respectively. Given the foregoing, it is apparent that extraordinary responses, measures to alleviate suffering of citizens of this country in communal resettlement in urban areas have to be intensified. I'm therefore appealing to development partners, private sector, and general public, inclusive of those in the diaspora, to rally with government to support the emergency relief in line with the policy which requires that every citizen has a responsibility to avert or to limit the effects of a disaster. The thrust of government is to go beyond emergency responses to building back better in the post-disaster recovery period. Our ministry will be contactable through the Directorate of Civil Protection. We've brought all the details and they are captured in our statement. Thank you very much.
Compliment on Honorable Minister. We haven't discussed this modality yet, so my apology if we have any element to add further. I think there is a very good partnership, existing partnership. There is also a very good response already as a first action. In situation like emergency, we shouldn't create confusion, but we should also respond promptly. So the hierarchy, the existing structure is a good way to move forward. Maybe the first element is there are agencies working on the ground, working together with the local partner and the civil protection and local authorities, meeting immediate need, what's needed to these people will be important. But probably there could be also element of guidance shared from the central level as we move forward and we have more updated information, etc. Because there could be issue related to health. I see Honorable Minister of Health here, and other ministries. So because we worry a little bit more on the concern related to water sanitation, normally in flooding and this type of thing, on waterborne diseases and etc. So I think we, from a partner point of view, UN as a humanitarian country team, we can reinforce that engagement together and work with the ministry and engage in a very coordinated manner, but without getting into too much bureaucratic elements.